Good afternoon. Welcome to this month's Perfect Practice webinar, Easing into the Cloud. I'm your moderator, Nancy Roberts. Easing into the Cloud is sponsored by National Physician Services, a charter member of the Perfect Practice Alliance. We'll be telling you a little bit about both organizations in just a minute, but first, let's get a review of today's agenda. We'll begin with a brief overview of National Physician Services, or NPS, and the Perfect Practice Alliance. And then we'll move on to a panel discussion of today's important topic, easing into the healthcare cloud. We hope that you'll actively participate in this question and answer panel session, and we'll tell you more about how you can do that in just a moment. After the panel discussion, we'll share a client story of a successful cloud implementation at a large physician practice with very impressive final results. And then if there are still any open questions after the interactive panel discussion, we'll be very happy to take them with you before we conclude our call. For those of you who may not be familiar with us, what sets National Physician Services apart from many other healthcare organizations is its physician founders. Early on, NPS physician leaders realized that healthcare information technology was complex, yet mission critical to their survival. So they decided to invest in expert technology resources to manage their own IT services across the enterprise. When this proved so successful, they went on to commercialize IT service offerings to benefit other healthcare organizations. Now here's a little history of the company. NPS was originally formed in Hartford, Connecticut in 2003 as Connecticut Physician Services, or CPS, a collaboration of 3 large physician groups who wanted to provide cost-effective, specialized health information technology services. A few years later, the company expanded their reach throughout Connecticut and the greater New England region. And in 2014, the board of directors of CPS decided to expand their regional footprint to the national level, and National Physician Services was born. In early 2015, NPS formed a significant strategic partnership called the Perfect Practice Alliance. The Perfect Practice Alliance, or PPA, a collaborative group of healthcare business partners comprised of physicians, IT experts, and industry-savvy consultants. The PPA was founded by 3 charter member organizations, National Physician Services, EHR Integration Services, and Bite Size Solutions. The charter members set the strategic direction for the Alliance. Each member brings a complementary set of health information technology products and services to the organization, along with expert consultants and staff. The Perfect Practice Alliance initiative embraces a human approach to healthcare IT, which simply means that using and managing the latest technology shouldn't interfere with a provider's ability to focus on patients. We want to make healthcare technology transparent, or better yet, invisible to the end user, woven into the natural process of delivering excellent care from the front desk to the clinical exam room and into the back office. Now I'm going to spend just a moment providing you with a very high-level overview of NPS's suite of IT services. As you can see here, NPS provides a comprehensive group of enterprise technology services across the spectrum of healthcare information systems, from expert IT advisory services to clinical and business application support to helping service-critical revenue cycle management processes. All of our IT offerings are supported by superior 24/7 customer service and desktop support, and NPS has the singular healthcare IT focus and expertise to oversee some or all of your needs through its managed IT services. And of course, today, we're here to talk about cloud services and implementation strategies. So you'll be hearing more about that during our panel discussion. Now, it's very important to us that you get value from your time over the next 30 to 40 minutes. And in order to make this experience as interesting for you as possible and to answer your questions, we're introducing a new panel discussion and audience participation format for this webinar. You have 2 basic options to interact live with our panel. The first one is to raise your hand electronically to indicate that you'd like to ask a question by phone. And you do that by clicking on this hand icon that I'm circling here. You'll see in your toolbar. And when we see your hand raised, we'll unmute unmute your phone and introduce you so you can ask your question live. If you'd prefer to type in your question, you just go to this question tab and type in the question, and we'll read it during the course of the panel discussion. And of course, if you have any questions at the conclusion that we haven't covered, we can take them for you then as well. So we will move along into our panel discussion, easing into the cloud. We expect that most of you are at some stage of investigating the benefits of cloud technology, or you've already started to maybe stick your toe in the water with a stepwise transition into the cloud, which is why you're with us here today. So we'll get started so that you can ask your questions and we can ask ours. Our panelists who will be fielding your questions on the cloud and how NPS and the Perfect Practice Alliance can help you ease into this critical technology. I'd like to introduce Brian Graven, CEO of National Physician Services, Mike Brown, Director, Technologies, and Tony Cinquegrano, Sales Executive. And I will just jump right in here with a pretty basic question. Brian, I'll just address this one to you. What are the major drivers, the industry drivers, moving practices toward adopting a cloud hosting strategy?
Great. Thank you, Nancy, and I appreciate the overview as well. When I think of industry drivers in healthcare that are moving physician practices and hospitals to the cloud, I think of a evolving industry, one that's very dynamic, and it's changing continuously. Meaning there's so many new innovations at the forefront. EMRs have become kind of the foundation of hospitals and medical practices. But now you have so much more that goes into it. And with that said, they all have a cost behind it. And moving towards a cloud-based infrastructure allows you to scale those various technologies that the medical community needs, but it also allows you to do so within a economic model for cost. Infrastructure expenses are typically really high, on the CapEx and the OpEx side, meaning capital expenses for stands, network equipment, really high over the last several years and continue to be high. And while the personnel expenses don't go down either. Moving towards the cloud allows the medical community to build a scalable model that is very predictable, almost like a utility bill, and to scale for those new applications and environments that they need. I don't know, Mike, do you have anything to add to that?
No, I think your last point is key in that the speed that you can deploy new offerings to your customer base is greatly increased by being within a cloud model instead of having to procure hardware and software. It's very easy to go in and scale up the the resources that you require to to deliver solutions to the customers. We've seen the maturity of the cloud offerings really accelerate in the past year, and a lot of the medical practices that are consolidating are becoming very dependent on their data, and they need some guaranteed uptime or availability to that data. It's becoming more and more a requirement as we move forward.
Yeah, you make a good point about the quality in data centers where these cloud environments are hosted. Most of these environments are hosted in a tier 3, tier 4 data center facility where they have top-notch security. And if you look at medical practices and even hospitals, years ago and even some now, they really don't have that robust environment to protect their sensitive clinical data. To have those types of environments, you need to have the appropriate investments. Moving towards a cloud model allows you to take advantage of a top-notch data center facility that has all those regulatory requirements figured out, has all those firewalls and security built into the offering, versus having to figure that out on your own and make those types of investments. Tony, anything to add?
Just really, by talking to practices, I found out that they're in the practice of medicine. They want to deliver the best care they can to the clients, and they don't want to deal with a lot of IT issues. So really, it's to leave the expertise to us.
Yeah. Yeah, so I agree with that one as well, Tony. The depth in resources. The traditional IT department, doesn't have the the staffing necessary to support these latest technologies. And I think probably the wiser investment would be to divert some of these funds to purchase clinical technologies and purchase technologies that are geared more towards helping providers treat their patients. Versus having to be in the business of IT, and I think that's a great point.
So it almost sounds like this is a sooner or later it's going to happen, and the sooner you start your investigation and really understand what it is you need and what it is that's out there, the better. And like most IT, I guess, flows, there's a period of time where we think we can do it, and then we realize that it's really not the business we're in.
Yeah, and one thing I'll close with, Nancy, is that cloud technology has matured drastically over the last several years to make it a really compelling argument to provide a high performing infrastructure at a reasonable cost versus I think the unknowns several years ago. So it's come a long way, and I think it's it's something very necessary for many practices to consider if they want to compete and stay up to speed with the latest technologies that are going to help them to enhance patient care.
So that really leads us into the next question, which would be assuming that if we're not already evaluating cloud technology, we will be very soon. What are some viable options for actually taking those easing steps into cloud technology? Maybe Mike, you want to start up? Okay.
Sure. One of the easiest ways to get into the having some sense of confidence in the cloud model is moving over a test or train environment into the cloud, and being able to actually see a system performing in that environment, versus right away moving a production workload out there, and gives you opportunities to do tunings on the environments. Most of the cloud offerings out there are provided within a virtual infrastructure, so you can even give production resources to a test or train environment, so you can actually get some sense of the performance of the system as it's going to run in the cloud.
Yeah, and one thing you kind of keyed in on, Mike, was the performance. Performance is essential in any type of hosting arrangement where you support clinical applications. So I echo what you said about moving a train or test environment into the cloud, performing that testing to ensure that the end user speed of the application is either comparable or even better from what we've seen in the cloud. Another area that you can key in on is perhaps creating a disaster recovery environment. We've set up many clients with a cloud hosting DR environment, and what we've seen is certainly it's a mirrored environment from their production workload, but we've had instances where they lose a critical system, and we've cut them over into our cloud DR, and once they're cut over, it's pretty much a pretty accurate reflection of how that environment is going to perform in the cloud. So it's a mirror replication of their production, and once they cut over, I think we've seen at least one client that decided to stay because the performance was comparable. And I think once we did the ROI analysis, they saw it was a lot less expensive to stay in the cloud, considering the issues they were having to begin with, and the fact that it was lower in overall cost.
Yeah, I would say that it's a question really of when as opposed to if practices are moving to the cloud. Just to reiterate a little bit what I said before, only 6% of the practices out there, according to Forbes last year, are not looking at cloud technology at all. So everyone's moving that way.
Yeah, I think the reality is we're in healthcare, and it's a very demanding space right now with the fact that there's just so much innovation going on, and I think to echo what Tony said, you have to take that step in the cloud sooner or later, and some of the things we just suggested right now allow you to tiptoe into the cloud, and really fill out whether or not it's a good fit, for your practice today. But at some point, we certainly see, that 6% figure, going drastically up.
And certainly it would give some reassurance to know that you can test your systems ahead of time, so that you have a good set of expectations. What's going to happen? What's it going to be like? And know that with reliability.
And with our experience, we really weigh the end user testing very heavily. Not only are we doing the appropriate testing on the back end, but it's all about the end user experience and ensuring that that application is performing to meet their expectations and their business needs.
Well, that actually leads into a question we just got from one of our listeners. Their practice is concerned with system performance and speed as they move into cloud hosting. What can you tell us about how you ensure system speed so that the cloud hosting is comparable to what they're used to in their local hosting? I mean, obviously, their business practices are probably hinged on how well their system performs. So what kinds of things do you do to ensure that speed and performance?
I'll take that one to start off again, Nancy, too. This is Mike Brown.
Very good.
One thing is having a very good understanding of the current environment that the users are running under. The last thing we want to do is take an underperforming system and move that issue into the cloud. So understanding the major components that are involved in providing the performance, the networking, the storage, and the compute side of it with CPUs and memory is critical to have an understanding. And there is a lot of upfront planning within the process of moving to a hosted solution, or even layering on top of DR solution in the cloud. But so coming into a customer site and doing a complete engagement of all their systems, making sure that we understand that it is performing up to specifications, and then understanding if it's not, which components are keeping them from that, so we can implement that once we go to a cloud model.
Good point.
Okay. Don't forget, you can engage in the conversation. If you have a question you want to ask, just look for your little hand icon here, and you can raise your hand and you can ask a question live. Or if you prefer, you can go to your question box that's also in your control panel, and you can type in your question and we'll get it in front of the panel. So let's move on to our question 3 here, and I think maybe Mike, this would be one to direct to you. What can you tell me about the actual process of transitioning into the cloud? What can I expect in terms, especially as you see there, of operational disruption, guidelines for time required?
Yeah, I think I started, hitting on that point in my last answer, which had to do with the upfront planning that's involved in, in the whole process, and coming in and completely understanding their starting environment. As far as operational disruption, I would imagine, or if we're doing our job right, all of the required downtime is planned for, and most likely is encompassed over a weekend. A lot of times we'll come in and provide, during these transitions, a read-only environment of what they currently have. So while we're transitioning to the cloud over a weekend, they still have access to current PHI. They can't update the information, but at least they have access to current medical records during that transition period.
Yeah, and I'll jump in. Typically, best practices when you're transitioning into a cloud environment, or even making a change within your infrastructure, you try to schedule these changes at the wee hours of the night, or late on the weekend, to minimize any downtime that the end users will experience. But we actually go the extra mile, and we provide that read-only environment, which I think is certainly appreciated by a lot of the clinicians that we support.
I think that if you're talking about a guideline to estimate start to finish, after the contract signed, if you're about a 30 or 40 doctor practice, I've been, I give out, and we've been fairly accurate to a really 2 to 3 months timeline to start to finish.
Yeah, certainly it's scope dependent. If we're working with a hospital and their appetite for downtime is a lot smaller than at a typical practice. We've seen project plans and scopes to where the implementation takes 6 months to a year. It certainly varies, and it depends on not only the size of the practice, but the complexity of the technology that they're using.
But it certainly sounds like with that plan going in and with the testing ahead of time and so on, they're going to have a good idea of what that scope is going to be like before they get started.
Absolutely. There should be no surprises in any of this. Certainly if you're new to doing a data migration, there's probably some anxiety. But if you're working with a skilled partner who has done this before, it's a very straightforward process, and there's downtime options that are certainly available. And if you're working with a good vendor, they should be able to provide you those options.
I'm sure that sounds very reassuring to everybody, because it is definitely a nervous-making proposition. And in that regard, that leads us into question 4, which is when it comes to cloud service providers, what are your recommendations for comparing good to better to best? You want to take that one, Brian?
Yeah, I will. Thank you. The clinical data is essentially the lifeblood of a practice, and with that said, I mean you just don't want to entrust your business, all your critical data to a vendor without vetting them and ensuring that they can do the services and do them well, because there's a lot that's at stake. Certainly, cost is a factor, but I would certainly probably look at the reliability of the vendor. There's good vendors out there, there's average vendors, and then there's really good vendors. If you're talking with a cloud provider, they should be able to pull a audit log of how many downtime instances they've had. You have to do your due diligence. You have to speak with other healthcare clients that have used their services in the past. You also have to take a serious look at cost. As much as a commodity as some may think, I think there's many different variables that contribute to cost, and not all vendors are created equal. I think that's important. But and I'll go back to my first point. You want to build a partnership. You want to be able to trust a vendor, because not only are they an extension of your IT department, but now they're an extension of your practice. And when something goes wrong, because there are still instances where things go wrong, you want to know that you have the proper support, and the proper resources on their side, to help you through a tough issue. And hopefully it doesn't happen that often, but we work in the world of IT where things do happen. So having that rapport, having that trust, and knowing what you're getting yourself into, those are all major things that you have to consider.
Yeah, I mean, clearly by the incidents in California and everything, the security can't be emphasized enough. Healthcare is the #1 target by cyber criminals, and it's only going to increase. It's going to get much more demanding. So your staff training and how they have their staff trained are going to be vital to your investment going forward.
Yeah, and the vendors that we have partnered with, we work with them on their internal compliance. So you have to make sure that they're meeting all the standard regulatory requirements for healthcare, for HIPAA. These requirements are only going to increase. So either pick one that is continuing to evolve, which you have to ask those very specific questions, or pick one who doesn't, and you find yourself not in compliance. So you certainly want to pay attention. And one other thing I'll add is that we operate in a business world of mergers and acquisitions. So you always want to make sure that the vendor or the cloud provider you're working with is a viable one, and one that's going to be there for the foreseeable future. You can't predict everything, but you don't want one that is close to selling their company, because everyone you made the deal with is essentially going to disappear, and you're going to have a brand new set of people that you're going to be working with and starting over with. And certainly you want to keep it consistent, and you want to maintain a solid business relationship, and know that the person you're working with is going to be there to fulfill the obligations that they've committed to contractually.
Okay. Now I'm going to get to question 5, which is probably the one that we avoid, and yet it's going to be extremely critical to making our decision. So we've looked at what some of the reasons are we might want to go into the cloud, how we evaluate various cloud technologies. We're talking about good, better, best. Let's now talk about your methodology for setting cost and that ever important ROI expectation. Brian, is that a good question for you to start with too?
Yes, absolutely. So as the first question we kind of touched on cost, but this one we can look at it and break it down a little bit further. So when we're talking about cost, we're talking about your capital expenses, we're talking about your operational overhead, we're talking about the building where all your equipment resides. What you have to do is you have to look at everything that goes into your on-premise hosted environment today. And with that said, you have to look at how much you're spending on all of your infrastructure gear, your network gear, personnel expenses. If you have to send your personnel to training each year to stay up to speed with the technology, every time you have to perform an upgrade, all of those expenses add up. So you have to take a really serious close look at all of your overhead expenses associated with your on-premise hosting. Once you do that, then you can take a realistic look at other providers out there and look at their costs and do an apples-to-apples comparison. That first step is really understanding your own costs. And that's something that we've done for many practices, because it's not necessarily an easy equation. It's easy for us to articulate it like this, but really deep diving and looking at all the figures and the salaries and all of the capital expenses, that's a little bit more challenging to uncover.
Yeah, I'd like to add too,
Okay.
that sizing, what you're moving out to the cloud, is important too, because a lot of companies that move from a CapEx model where they've already have all the equipment in-house tend to over-provision things, and this is really takes effect in a virtual environment. When you move to a hosted cloud methodology, you're paying for those resources, be it a gigabyte of memory or an extra virtual CPU every second that you run that. So, one of the big services we provide is, having that understanding and right sizing what you're, actually paying for out in the cloud. Another fact too is just with the cloud providers, they take away a lot of the staffing needs for upgrading the virtual infrastructure, stuff that normally when you host in-house that you have to do yourself, and it doesn't take long for for those savings to add up, and once you add up to a full FTE, you're talking in the $100,000 plus range in savings by shifting that to a cloud model.
Yeah, and you had touched on it, Mike, but the different types of payment models that the cloud providers offer, more the consumption side. So you're not paying for wasted space anymore. You're essentially paying for consumed space. So it's like a utility bill. If you use a certain amount of space, you're going to get a bill that reflects that. When we're starting to talk about the on-premise hosting, you're essentially, buying a space to build up to, a certain threshold, and if you, start to reach that max, then you buy more. But, in the interim, you're still paying, for that space that's unused. But there's some clear advantages to that, and, I think overall, if you look at like a 3 or 4 year pricing pro forma, you save a lot more money, going with that utility bill style, which is based on, data consumption.
We haven't talked about, like the obsolescence and having to replace this equipment every few years, and the amount of labor it takes to do that, it's just tremendous. So however you want to deal with the personnel savings, you deal with that yourself. If if it means just saving people for special projects or whatever, you just deal with that.
Yeah, and the other thing I'll add is that in a lot of instances and practices that we've worked with, there's a lot of downtime, and the downtime involved and supporting your own environment, that's clinical downtime right there, meaning you don't have access to your electronic health record, you don't have access to your practice management system. And I would say that all the listeners on the phone, they should take a look at their downtime over the last 2 years, and add up what that lost productivity is, and put that into your calculation as well. Because when you move to a cloud environment, one of the main purposes is it's a more stable environment. So that certainly adds to the ROI, and the overall bottom line. And not to mention, we talk about cost and we talk about ROI, but there's also perception out there. No physician, no provider, wants to be in an exam room, with their patient, and they can't access their patient's data. It's embarrassing. Certainly it doesn't reflect well on the doctor. It hurts patient care, and I think that is a big component into moving to the cloud. Just as much as the hardcore dollars and cents that we're talking about as well.
And maybe you've anticipated a question that just came in from a listener, which is beyond cost savings and ROI, what contributing factors do you use to determine the success of cloud hosting projects? Seems like you kind of almost started the answer to that one.
Sure. And I think beyond the cost savings, I think you have to look at if you're taking full advantage of the capabilities of your cloud solution, if you are able to scale that environment, if it's stable, and if it's performing and meeting your expectations. And I think after you've realized you're accomplishing all those things, are you still worrying about your cloud environment anymore? Like you were your on-premise environment. And I think if you 6 months after your implementation, if you can sit there and you can reflect and say, I don't even think about my infrastructure anymore because it's meeting my expectation and it's doing everything I needed to do, it's a success.
Yeah.
So one final question here, and I think to a degree, at least for me, it would sound like I would be sold on I'm going to do something in this regard. I'm going to start looking into it. What advice can you give in terms of the contracting perspective when you're moving forward or want to move forward with a specific vendor to ensure that, in fact, the offering is meeting expectations?
I'll take this one, guys.
Okay.
So from a contractual perspective, you want to make sure that you're protected in any cloud hosting arrangement. I know that's a big concern for many healthcare organizations out there. You want to have your BA in place. You want to have a separation agreement in the event that you're not satisfied using that cloud provider, to where you can seamlessly move to I guess back to a on-premise solution or to another cloud provider without any headaches or hassles. You want to make sure that they have all of the appropriate personnel within their solution offering to support the technologies that are required. You want to make sure that they're up to speed with the security aspect, and all of those various things. Not to over analyze it, or but those are kind of the core things that I look for. And if they don't want to participate, and if they want you to sign their BA, well, there may be an issue there. I think medical practices, healthcare organizations, they need to recognize that it's your data, and if a vendor's not willing to abide by your standards, there's plenty of other great cloud providers out there that will work with you. And when you're looking to partner with a cloud solution provider, you want to make sure that you really do have all the contractual language in place.
We're going to give people an opportunity to, if you've got more questions, get them into us. You can type them into the question box. You can raise your hand. But in the meantime, we want to take a look at a client success story. And actually, this is a great story because it'll give you a sense of exactly what was involved in one client's conversion to the cloud and what it did for them. This was the Starling Physicians Group. They're located in Rocky Hill, Connecticut. It's the largest physician-owned practice in the state with 250 physicians at 30 different locations, and their transition to the NPS Cloud Suite was in 2014. And what they told us was that in early 2014, we made the decision to migrate all of our clinical and financial applications to NPS Cloud Hosting and Disaster Recovery Solutions. The latest projections have our practice saving $225,000 in data center costs over the next 3 years. That sounds pretty impressive. So let's find out how that actually happened. The challenges. Brian, you want to tell us what they were facing when they made this decision?
Sure. So Starling Physicians is an excellent example of a growing practice that it is evolving like many practices and even hospitals throughout the United States, going through a lot of mergers and acquisitions. They had recently acquired a group of 100 physicians, making, I believe the new total is about 300. So, a fastly growing practice where, they have many systems that they're inheriting. So a lot of different technologies that were all coming into, one umbrella, and, multiple, data center environments. So, the complexity was there with, the different applications, those applications being different PACS systems, electronic health records, practice management systems even. And, to say that, it's easy to support all of those various systems is, is not true. It's very, very challenging, not only from, a system administration perspective, but also, a technical and infrastructure perspective. And with that said, they were having with all these different instances, they had multiple environments, resources dedicated to supporting all these multiple environments, and they were seeing a lot of downtime. So they were paying a lot of money, seeing a lot of downtime, and it was really hurting patient care. And it was really compromising the growth strategy that they had. So we started working with them, to consolidate the multiple environments that were now under the Starling umbrella, and really bring them into a cloud hosting environment, and perform all of those migration services that we spoke about before.
Okay, then let's move on to what the solution was. What was it that you offered them that would help them solve some of their problems? Mike, is that a good one for you?
I can kick that one off, certainly. Okay. One of the big factors around cost savings and reliability was the fact that we virtualized their infrastructure. They were probably 80 to 90% in a physical server environment, which hurt their uptime numbers that they had, and it also meant that we essentially cut in half their data center footprint that they had in their current environment to the one when we took over the hosting. So the cost savings per rack there probably adds up to between $150,000 to $175,000 over that period. In addition, by running the virtual environment in an N+1 scenario, meaning we have extra hardware in place in case one of the other components fails, means that the uptime also went up on these systems. Also meant being in an N+1 environment where we could bring down physical systems with, for routine maintenance during the day without impacting the clinical work that was being done. So we were, in the past, and when they had their old model, they would be forced into doing these kind of situations off hours, and it had an adverse effect on their uptime.
Okay, and then finally we'll take a look at what the results were, and this is always of interest to everybody. What exactly happened? And Tony, you want to take that?
Sure, this is everyone's favorite part, right? So they reduced the downtime from a day and a half to really less than an hour at the RTO. That's a recovery time objective. They reduced their RPO from a day to 15 minutes or so. So that's the business continuity planning. That's like things that the amount of time you want to be down for to limit the major incidents. They implemented, like Mike said, the N+1 model. They they cut their upgrade time by greater than 50%. And they really took a look at what they're using for people, and they reallocated some people on high-value projects and innovation. And finally, at least $225,000 over the first 3 years.
And Tony, to play off those first 2 points, in addition to taking over the hosting and moving it into the cloud, we also provided them with a cloud-based DR solution. So the RTO and RPO are directly related to that. And in our old system, they really had no disaster recovery, so probably some of those numbers, even as dramatic as they look, maybe were even worse, on the downward side of that scale, because they were really in a cold DR situation where they'd have to stand up hardware, load the systems onto it off of backups, and then bring the environments back up, as opposed to the model we delivered where they would only lose 15 minutes worth of data, and we'd have them back up and running, and our stated goal is in under an hour. And that's for business critical PHI kind of stuff. Some of the ancillary systems would come up after that 1 hour, but the basic PHI was up and available to them within that time frame.
Yeah, and if Nancy, if you were to rewind the slides 3 back, Dr. Post smiling in that first slide.
Yes.
Him not worrying about the infrastructure anymore.
There he is. There he is, looking very happy. Yes, and that's very true, because not only is there a cost savings here, but the immeasurable is what it means to their peace of mind as well as their reputation. So those things are they're hard to put a dollar amount against.
Exactly.
Well, thank you very much, and we thank you all for joining us here today. We hope you've learned something. We hope that if you have any more questions, you can visit us at the HIMSS 2016 in Las Vegas. We're going to be at booth 13151, and you can meet the Perfect Practice Alliance team there. If you have any more questions, you want any more information, you have questions about your practice, about the cloud, you can give us a call or send us an email. You'll see the number or the address there on your screen. And again, we were very happy that you were able to join us today, and we look forward to hosting you at an upcoming Perfect Practice Alliance webinar. And we hope you all have a really great afternoon.